Hi, my name is Dr. Badr and I'm a general surgeon at Wabash General Hospital. Today we're going to talk about hernias and basically abdominal wall hernia. These are the topics that we will be talking about today. Definition, as in what a hernia actually is, the different types of hernias. We will be restricting ourselves to abdominal wall hernias. We will not be talking about hiatal hernia. The risk factors, meaning who are the ones who can get a hernia. We will be talking briefly about symptoms, and we'll be touching the topic of treatment and repair. And that definition, hernia. A hernia is basically a protrusion, bulge, or projection of an organ or part of an organ through the body wall that normally contains it. As you can see here, there's the intestine and the abdominal wall contains it, but if there is a defect in the abdominal wall, the intestines can protrude out, thus making it a hernia. These are usually classified by location or by the cause. Now, the types of hernias. Approximately 5 million Americans have an abdominal wall hernia. Most of these are groin hernias. This is a picture which basically depicts it diagrammatically. The groin hernias can be either inguinal or femoral. Belly button hernia, as commonly called, are the umbilical hernias. Things above the umbilical hernia are usually classified as epigastric hernia. And then we have a common term called incisional hernia, which can basically happen anywhere where you've had surgery on the abdomen. As you can see, the list of types of hernias is fairly long, and this is in no way a comprehensive list. So we will be restricting our talk to the most common ones. So let's talk about who all are at risk for hernias. Any condition that increases the pressure in the intra-abdominal cavity may contribute to the formation of a hernia. These include the following: marked obesity, heavy lifting, chronic cough, prior surgeries, straining with bowel movements or during urination, fluid in your belly, history of dialysis through the abdomen called the peritoneal dialysis, history of shunts such as VP shunts, COPD, and family history of hernias. Let's talk about symptoms. Symptoms of hernia essentially include almost always a bulge, which could be constant or intermittent. It can be painful or painless, and it usually will enlarge on either standing or by increasing the abdominal pressure, say by coughing or doing strenuous activities. An incarcerated hernia is when there is painful enlargement of a previous hernia or the previous defect. There's inability to manipulate the hernia, either on its own spontaneously or manually through the defect. There's also possibility of nausea, vomiting, and bowel obstruction. A strangulated hernia does have symptoms of an incarcerated hernia, but on top of that, also has a toxic appearance, meaning the patients can be really sick. They do have symptoms of systemic toxicity or also possibility of an ischemia to the bowel, which is also called in common terms impending gangrene. There's possibility of strangulation if pain and tenderness of an incarcerated hernia persist after reduction. So as you can see in this picture, this basically shows one of the earliest stages in a hernia where the abdominal wall has weakened, the intestine is just bulging out, but there doesn't seem to be any restriction in its going back. Intestine continues to push into the sac, and at times a time comes when this becomes trapped. This is when it can be called an incarcerated hernia. If it does not go back, the intestine gets stuck in that spot, and then it keeps getting swollen, and it can become what we call strangled or gangrenous. If you or your loved ones have any of the symptoms mentioned above, then talk to your doctor. Most of the times when identified, abdominal wall hernias should be evaluated by a surgeon. Let's talk about the hernia repair. The repair of hernias is essentially a surgery. The surgical repairs include multiple options depending on the location of the hernia, the patient factors, emergency or elective setting. Open repairs, as you see in this picture, involve making an incision directly over the hernia, then putting the contents back in, and then repairing it with a reinforcement which we call mesh. Laparoscopic repairs usually involve going away from the site of the hernia itself and then working with small incisions using specialized cameras and instruments. Nowadays, we almost always use tissue reinforcements, what we call mesh. That last picture that you see, it basically summarizes what is done in a hernia repair, where we reduce the hernia sac into the abdomen and then we reinforce the area with a mesh and then close the abdominal wall over it. If you have any questions regarding hernia or the type of repairs or any other questions regarding you or your loved ones, feel free to call our office. We're here to answer any concerns that you might have. Thank you very much and have a nice day.